Good evening, and welcome to the third annual Alan and Gwendolyn Krause Patient Safety Lecture. It's wonderful to see the audience full. I know there are people across the country who have reached out to me and said, let us know how tonight goes. We're interested in this topic. We have to make this a part of healthcare, not only within a system, but throughout the country. So again, thank you. So tonight you're going to hear about the CANDOR program. The CANDOR program is an acronym that's short for Communication and Optimal Resolution. I think it's the most important program to come into healthcare in the last 15 years.
The role of family members at MedStar Institute for Quality and Safety and in the lecture tonight is really to ground this in the reason that healthcare is what it is. I mean, we're here to take care of patients and families. We're here to help them heal. We're not here to harm them. When they are harmed, we need to learn from that. And we need to have cultures and organizations that support that kind of learning. Not avoidance, not denying it, not defending it, but learning from it and preventing it. And engaging patients and families like we're doing with the Krause lecture here tonight, because we're going to have two very compelling stories of families that have been impacted by preventable harm. I mean, they see things that will help us be the kind of organization we want to be, both at a cultural level, but also at a safety level. We're going to learn things about how people want to be treated that will help us be better doctors, nurses, administrators, lawyers, patients and family members.
April 8th, 2013, my life changed. During the course of the surgery, there was equipment malfunction, and fairly catastrophic, and for the longest time it was an adverse event. And being a non-medical person, I wasn't sure what an adverse event was. And then Larry explained it to me one day, and I said, well, you may call that an adverse event, but I call it a catastrophic event. You know, I can't say enough good about what MedStar did for me. My recovery has been pretty good, believe it or not. I'm still an incomplete quadriplegic, but I have the ability to get around and do things.
The transparency leads to the early intervention, so that's when many people need the help to recover and may not have it. So when you're able to start up front on day one with this information, then you're much more able to make a much better, have a better prognosis and a quicker recovery.
So I want to say that a couple times it's been said tonight that CANDOR, or this approach, is about doing the right thing, and I absolutely agree with that. But I also want to say that doing the right thing isn't the easy thing. And unless you have an organization, an administration, a leadership, a board that's willing to support your doing the right thing, you can't get it done. How can you go to the folks who are on the field and tell them to do the right thing and leave them not knowing what that means? How far can I go? What can I do?
After the surgery was over, Dr. Tortolani came out and sat down with me and talked to me. And it was very, very difficult for him. He and Jack had had a prior relationship and knew each other from another surgery Jack had had. If you can just imagine having something happen and nobody coming and explaining anything to you, nobody coming back to see you, nobody telling you anything, well, it didn't go well and that's it. Even though it was a bad outcome and it was not positive news, it was still presented to us.
The impact for me on this whole situation is very hard to gauge. I think it's still impacting me in many ways. I think probably the greatest impact is hopefully it's made me be a better doctor and be able to connect with patients better. And a week doesn't go by when I don't somehow reflect on our experiences together. I think that I've found tremendous gratitude in the support the institution has provided. MedStar and my hospital. I reached out immediately to Brad Chambers, our CEO, and our risk management team to help assist in this process, and to have a big brother like our hospital and MedStar on top of Union behind you and giving you support along the way as a doc is tremendously satisfying. And when you're going through it, you're just not 100% sure how much support there's going to be there. So it's made me grateful and honored to be a part of the MedStar family, and it's something I still cherish.
Patients who tell me, who are now my plaintiffs, what happened? Well, we don't know. We don't know what happened. Why? Because nobody told us what happened. We don't know why my baby's brain damaged. We don't know why my father's dead. We don't know why Jack is paralyzed. No one told us. Or worse, they lied to us. I know this is hard for you to believe at MedStar, but there's a lot of lying going on out there to a lot of patients, not MedStar patients, which is why I'm here tonight. When I heard about this CANDOR program, I thought it meant candor, another acronym for them. For me, it meant transparency. It meant people are actually going to sit down with their patients, and if there is a medical mistake, if it happens, and it does, they're going to tell them about it. They're going to be frank and honest about it. My plaintiffs won't be angry. They're not going to be lied to. They're not going to be ignored. Nobody's going to refuse to answer telephone calls.
When our oldest daughter was diagnosed with a polycystic liver, she went into the hospital on her youngest daughter's first birthday, which she was never able to celebrate. She expressed her concern about waking up during the middle of the procedure. He said, not to worry, we'll give you enough anesthetic that you won't wake up. How little did we know he was telling us the truth.
I think it's important for us is to let everybody know how important transparency is. And if Dr. McDonald and his staff had not been as honest with us at the beginning, we wouldn't be where we are today. It was hard to accept, but yet it was the truth. The hospital did make an error. And I remember when we told our other family members and our friends what happened, and the hospital said, hey, we're sorry, it's our fault. No one believed us. They said hospitals just don't do that, but they did do it.
And I emphasize the importance to MIQS, the MedStar Institute for Quality and Safety, but also to MedStar as a whole, in really creating educational venues to share these ideas, not just within MedStar, but within the community that MedStar serves and all the stakeholders in that community. Because the kind of change that we're trying to accomplish here, that shift from an old paradigm of deny and defend to continuous learning, better safety, really aspiring to zero harm, requires kind of an alignment of multiple stakeholders, including law, medicine, the community, people who understand that this work is going on.
I witnessed firsthand the communication and the open discussion that the hospital, the doctors had with both myself, Jack, Teresa, and the entire family. I saw, both as a lawyer and also as Jack's brother, I saw the tremendous benefit that it had, and I want to share that with everyone, as Jack does, as Teresa does, his wife. I want to share that experience with everyone, and hopefully from that, maybe legislation can be passed, as it's been introduced for the past couple of years. Maybe we have a hope of passing some of the legislation that would allow for open discussion and free communication.
Day one, they were there. Day one, Dr. Torlani, I was there when he was talking to the family. And I tell you, as a plaintiff's lawyer, I was a little bit skeptical. What's going on? MedStar is coming up and saying, we'll do whatever you want. Teresa and Jack would say, what's this all about? I go, I don't know, but let's ride the wave right now. But if this is a patient safety bill, shouldn't the focus be on the patient? It should be about the safety of the patient.
think we have to change the culture. I think we have to change the environment in which medicine and law are practiced, both. I think we can all benefit from each other's perspectives. I believe that MedStar is making enormous efforts and strides to drive down the error rates in medical practice, as well as dealing transparently, truthfully, and with candor with their patients and their families should there be a medical mistake. I'm jumping in with these people to help with what little I can help, okay? I'm committed to this grab. Why? Because I think they're the national leaders of what we need to be doing. One, patient safety. Two, God forbid something goes wrong, tell the patient. Deal with it, do the best you can.